problems?
No, he's been good.
Okay, stay right there.
Mommy, baby, what a good baby you are.
Okay. Alright, so what we're going to start with here is let's get rid of some of the extraneous stuff like the paper. And we can play with you with the tuner too and see what you respond. Okay, so first we're going to start assessing dehydration here, okay? The skin turgor will look good, okay? Normal skin turgor. Okay, alright, now let's put our hands on you and see about your body condition, boy. A little hard because you got long hair, so we can feel the ribs but not see them. Can feel the spine lightly and the hips lightly, so you're normal. And then we're going to feel the muscles around your tushy and your shoulders, and yeah, those are nice, big, powerful forelimbs. Okay, so you got good muscle mass and tone, bro.
He's a good jumper.
Nice coat. Yeah, okay, he should be at this age. Okay. Okay, good. Alright, so let's do a little combing on you. I know you don't got no problems, but this is for the purposes of drama, okay? This is drama. Let's comb you through and see what you got going.
Good boy,
okay?
baby. Good brushes.
Very nice coat, not hitting any scabs. Okay. Do a little combing here. What a man. Okay, it's all good. Clean comb out, nice coat. Okay, good. Alright, so while you're sitting out there exposed, let's get a respiratory rate on you, okay? That's 60. Normal for a nervous kitty. Okay. Alright, I'm going to pull this over because pretty soon here we're going to bundle you, but you're sitting out there so chill so we can listen to your heart without that, and then you're going to get bundled, alright? Alright, here we go. Here's Mr. Heart, okay? We're going to get way underneath there, okay? We got to get under your breastbone.
Is this harness?
Oh, that's your harness, okay. Alright, that's fine. We'll get
off.
around the harness.
Okay.
I don't think we have to have you strip. Okay, very nice. Now let's listen to some other places. Okay, and we're just gonna kind of go across your chest and listen to your lungs, which sound very clear. Okay, no problems. Okay, so let's listen on side B now. Okay, we gotta get up there under that clothing, okay, because that's where we hear it good. Okay, you got a nice heart, bro. Your lungs sound good too. There aren't many cats in Lane County whose lungs sound good.
I have to bring Cricket
all right,
in. I
good.
think his might have.
No, you stay right there.
sounds.
Don't touch that dial, okay?
You're okay, baby.
Alright, so far so good. Alright, let's do some other things. Let's put this away. Alright, you gotta hook it up because otherwise it's going to hit the floor and make a big noise. Okay, so I usually do a lot of their lymph nodes from behind. Okay, so let's get your submandibulars and your retropharyngeals. And you're a little bit young for this kind of stuff, but you might as well practice. Let's see if we can feel for Mr. Thyroid. Okay, let me turn your head just a little. Okay, there's Mr. Thyroid gland, but we don't feel him. He shouldn't be out. He needs to stay where he belongs. So look at that fancy collar you got. Everything, all your clothes are matched. That's a great color for you. Okay, good. All right. Okay, good. Now let's get way up in your pits here around the outfit and see if we can feel your axillary lymph nodes and your lateral thoracics. You're doing very well, darling. Don't fall, okay? Because it's a long way down and you're starting to flop off the table, okay? All right, now let's check Mr. Belly, okay? Doing extremely well. Okay, we'll check your popliteal lymph nodes. Okay, and the other side here, you're kind of squished up. Okay, I'm sorry about this, but I think you need to model for the camera. I'm going to show everybody how we take your temperature, brother. You want to stick your head out a little bit so it's not so, you don't have to be hidden, you just have to be comfy, okay? So let's get the lubricated thermometer. There is no other kind. Does he need vaccines today, Andrea?
I think yes.
Okay, so.
I think he's due for all 3.
Yeah, so how are you feeling about that? Does he handle all 3 well, or I can talk about different ways we can handle that.
Yeah,
I don't want to load him up, you know.
Yeah, I was thinking distemper and rabies if
Yes.
you could.
Uh-huh.
He only goes outside when we go hiking or something like
Well,
that,
that's
but
probably
otherwise
fine
he
if
stays
he's
in.
accompanied. Maybe he doesn't even need any more leukemia shots. Okay, you might be a side guy. Either a butt lift is a good thing to demonstrate too, so that's all right. Okay, so let's try a side shot, okay?
Yeah.
And we're gonna, this tail is quite fluffy.
So go fluffers like
Okay,
that there.
all right, you comfy?
Okay.
Mom's got you. She's not gonna let you get hurt. Okay, and then we gotta feather away all this, and there it is. Okay, so we're gonna go in kind of easy, but if you're getting vaccines, you need to have your temperature taken. All right, how's that going for you, bro? Is that working for you?
He's fine.
Good. All right, what a good man. Everything's nice and clean and normal back here. 101, normal for Kiki now, okay? Okay, so part of what we have to show here is the trumping of the fur after the temperature is taken. Okay, 101. Okay, so far so good. Okay, so we did everything here. Abdomen's normal. Heart and lungs is normal auscultation. Lymph nodes is all normal. Anus and prepuce is normal. Okay, we like that. Alright, so let's wrap you up and let's spin you 180 degrees. What we often do here, it may not be necessary with Andrea, but we often have the folks come down and face the cat at this end when we start looking at their head, because they're usually turning around to look for owners. But Mom's got you, okay? You're a great guy. You don't have to worry about nothing, okay? We might do a few extra things here that we don't normally do, just for the camera, alright? You want us to do that? Okay. What do we got? Okay. You want to smell that? Yeah, okay. Alright, let's start with just a superficial ear exam. And in a minute, if I don't resettle myself, you're going to get a picture of me falling off the stool. My regular one is broken. Okay, alright, good.
Do you want to cover your eyes?
Okay, you can hide your head. Now that's a very good idea. You don't have to see any of this if you don't want to. Okay, let's use the ear cone a little bit. We won't go deep. You don't really have any problems with the ears, but like I say, we're doing this for instructional purposes. Oh my God, there's light coming from the other side. Okay, alright, yeah, that was supposed to be a joke. That funny, huh? No, that's not funny. Okay, alright. Alright, good. Alright, now let's look at your eyes, okay? You show me what your eyes look like? I know. You don't want hands coming in your face, I get that, okay? So let's face the camera. Okay, we don't want to squish any whiskers, okay? You got really long ones. Okay, that look very nice. Very nice. Good, okay? Why don't we pretend that we're going to look in your eyes a little bit more? We don't usually need to do that with you youngsters, okay? But we'll just play a little game here. Okay, good. I know, it's very bright. And here's Mr. Schnoz. Okay, good. Okay. Now let's look at the choppers, okay? Okay, let's look at the choppers, okay? I know, you don't want hands coming here. Turn that way. Yeah, you'll do better if you come from the side rather than the front. Okay, now let's look at the choppers. Oh, look at that. Big, nice choppers. Capillary refill's good. Open wide. We're going to push up your tongue. Good job, my man. Okay, now let's turn that way. Okay, we're going to look at side B. This is a side A and a side B. All right, okay? Okay. Someday you'll thank us for all of this. Just not today, honey. Right? Okay, good. Look at those teeth. They're very, very clean. Is he eating some dental food?
Yes,
good.
Yes.
All right. Well, let's see what kind of shots you need, bro, and let's figure it out, okay?
Good job.
And you need to get weighed, so maybe Andrea can put you on the scale and show the folks how that's done, all right? Yeah. So we need to be very careful with Mr. Camera here, Luca, okay? We don't want to knock him on the floor. Okay, so everything looks good.
Hold on. 10 pounds, 3 ounces.
10-3. Okay, let's look at your weight history here. Let's make sure that, yeah, it looks like, yeah, he's grown since we've seen him. Okay, now let's look at shots. All right, so, yeah, he's overdue on leukemia, but he's had that initial kittenhood series, so I don't think you necessarily need to do that. And then, yeah, he is due for distemper and rabies. What I would do is probably just give him the distemper rabies combo this year, and then next year we can spread him out to 3-year shots. But I think that's less impactful on him.
Okay.
So why don't we get the brother his distemper rabies combo, and but the exam is free because we did him as a demo.
Oh, okay.
But, yeah, you're a demo, okay? Now this part we probably don't want to show, huh? Because you're hiding. You want to hide with me? Because this is what we do when we are, get rid of that blanket, it's going to throw me on the floor. You want to stick out a little bit? Here you go. There you go, look at you, okay? All right, this is almost over, and then you can do whatever you were planning to do with your day anyway, okay? Yeah. Did you get enough footage, or is there anything else you might want to get that I didn't do? Was it? Oh, yes, we're going to do that. Yeah, absolutely. Yeah, we're going to give you a shot, and then you're going to get a pretend nail trim from the best in the West here. Andrea's very good at handling kitties and getting them relaxed for that. Yeah, your very own mommy knows everything about nail trimming, Kiki Mouth. All right. And he just had that Western blot in October. I don't see any reason to repeat anything there. And he seemed healthy at home. There's probably no reason, you know, if you wanted to say pull a complete blood count or something, you could, but I don't think he really, you know, needs that right now. His color's good and all. All right, why don't you slide up, okay? You're hiding.
I thought we...
I think we got all of that back in October.
Yeah, I was going to say, I think I pulled for everything, just because it was around his yearly.
Yeah, no, you do. You should might as well get all you can while you can. Okay.
I know we talked about maybe doing the FIV real PCR test, but
yeah, we wouldn't be wrong.
I mean, he's positive.
That's right. Not much you can do.
Just keep him as healthy
as. And he's doing well. I mean, this is often a disease they can die with rather than die from. Okay, so let's do a little pokey in the bum here, okay? We're going to aim down towards your stifle there, bro. Okay?
Did good, BB.
Alright, very good, my man. Okay, so show Vicky how you get your nails trimmed, my boy. There's the little skizzers, okay?
There's a couple of ways that I do it, but if they're comfortable on their side, then I just do them like this. And usually I'll start with the back first. And I'll just kind of cuddle them, let them hide.
And he has immaculate teeth. There's nothing to be done with him dentally.
Oh, good. And then I will just do snip.
Okay.
No. And I'll try to put my hand right here behind their hawk area just to support any major kickage. And then just go nail to nail. If they allow me to, I'll bring up the other side. If not, I'll just come up to the front.
What a man.
Like that.
Yeah, look at that.
Job.
Look how handsome you are.
And then we turn over.
Get beautified.
Cuddle. Good job, baby. Snip, snip. And then back to the front. Also kind of making sure that their head is away from me, just in case they get a little grumpy.
You wouldn't do that. No, would you?
That one's pretty good. There we go.
All right. What a man.
Good job.
What a man. All right. Well, thank you, Luca, for helping us. Is there anything else we can film on him that you